The healthcare industry has been impacted by the pandemic more than any other sector. Leaders have stepped up to create and address the possibilities for this moment in time in healthcare. Throughout the last year, A&M Healthcare Industry Group professionals have connected with healthcare leaders across the country to learn more about their inspired solutions to these complex problems and assist in their efforts.
I think as leaders, we need to start thinking even bigger and start thinking about how do we actually generate and prompt social change along with delivering these interventions that I think make a difference.
At this turning point in healthcare, we see leaders tackling social issues, driving transformation across their organizations, and creating impact in their communities.
We know that over the past couple of years, COVID has really exposed a lot of the problems that we have in healthcare, but clearly one of them is the inequities that we've seen and the disparities that we've seen among people throughout the country.
What we've got to do as a healthcare sector is begin working incredibly diligently and focused, sort of problem by problem, on how do we remove the inequities that exist in so many communities from existence.
Health disparities are driven by only in part medical determinants. They are largely driven by social determinants that often AMCs are not readily set and equipped to deal with. So we've taken on this sort of grand challenge, as it's called, few universities have, to go into neighborhoods, both rural and urban, to deal with sidewalks, to deal with food deserts, to deal with reading and education, to deal with primary care access, to deal with walking and play safe areas. The things that we often take for granted, but that are fundamental to keeping somebody at their house versus in your emergency room because their refrigerator broke down because they couldn't keep their insulin.
We've taken the bold step of actually tying executive compensation to closing healthcare disparities. And I think that that's been super meaningful, and we think it's a model for the industry.
The pandemic also shed light on behavioral health and mental health issues and access to care, and has forced the industry to begin to think about mental health and physical wellness together.
The industry has changed to finally, I think, recognize that it doesn't make sense to think about the head over here and the body over here, but really the holistic view of a person, not only in terms of their behavioral and physical health, but also in the environment in which they live and the environment in which they work, and in what kinds of social influences may be contributing to the outcomes of their health. So I think with that change in reduction in stigma and the ability for employers to really look and understand that keeping a healthy employee and a happy employee ultimately means that their business will do better, has really created a terrific time for us to get this right.
Transformation is needed now more than ever, leveraging technology, innovation, and forward thinking.
The opportunity for all of us to work more closely together, more collaboratively across all the different facets of our industry, to lean in together to transform healthcare.
The pandemic propelled transformation through the increased use of technology to change the model of care delivery through virtual technologies. The shift to personalized medicine and change in sites of care delivery, and a continued focus on value-based care models.
It's the opportunity to do as much as we possibly can in the home setting, to do a lot of this virtually when it makes sense, to do it digitally, but then to make sure that we have deep resources in the outpatient setting. Many of the things that, a couple of decades ago we would do in an inpatient facility, we can now do in an outpatient facility, closer to home. There's a future for that as long as I can see forward in the hospital setting. Hospitals are not going away. They're just going to be highly sophisticated. They're going to offer the services that are not available anywhere else.
We're building an actual application formulary to reach that goal of connecting patients to personalized medicine via a digital interface that we may not control, but that we have checked out, we have endorsed, and we may augment the customer support that the company provides so that our patients can use that electronic application to better their health
And then what we knew was likely to happen, because we've been talking about it, is this move towards outpatient, more ambulatory. And that has absolutely accelerated through COVID, in particular in the ambulatory surgery space. So all of that said is that clearly a lot of headwinds. And so it causes us to have to rethink about how we reposition, how we think about, how we approach the work of our healthcare ministry so that we can continue to deliver care to the poor and the vulnerable and also those communities that we serve.
We know that Geisinger has a history of being one of the innovators in healthcare and using its unique financing and care delivery models to change healthcare for the better. And we know that that's very much about what your leadership has been about as well. And so thinking about value-based medicine and addressing some of the issues in health disparities and health inequality, I wonder if you wouldn't tell us a little bit more about what your vision is.
When you marry up the financing and the clinical. And I think when we do that, we've seen that it also leads to a more equitable result in healthcare, because you don't have to worry or health systems aren't swayed inadvertently or, God forbid, even purposefully around the rates of payment that they may get, which may be different across the different kinds of populations, across Medicaid versus Medicare or commercially insured, for example. But in a value-based world where, you're taking risk for the population, you're really freed up from some of those dynamics and just able to focus on better health and what makes things easier for people.
The impact of COVID can be felt in the workforce challenges that have resulted across healthcare organizations. A crippling nursing shortage, a rise in labor costs, enhanced use of travel nursing, and the implementation of innovative recruitment and retention strategies for today's workforce.
The nursing shortage has really driven up salary, right? And the amount of money that organizations are now spending to secure the same resources that they have been for quite some time is increasing so rapidly. Right now, we're seeing that inflation is outpacing compensation increases, but still, as I mentioned, hospitals are facing a labor expense they think maybe 30% even higher than before the pandemic.
Healthcare is the backbone of many communities, on the cutting edge of new and life-saving technologies, and the leadership is at the forefront of change. As healthcare continues to evolve, A&M Healthcare Industry Group is partnering with leaders and organizations to innovate, transform, and optimize operations to help enhance care delivery, drive change, and spur growth.